schedule.
Do I look smarter? Do I look like a speech better?
I think so.
I'm getting better time. I'm feeling it.
You're having an easier time with words today.
I'm knowing that 7/24 is Wednesday. 3
Yeah.
months. 3
Yeah.
months, and I know that this is like a point that is pivotal, and I just want to be. I don't know. I haven't seen in my hand is starting to look a little bit normal. And
Yeah.
I've been putting it on the machine, and it's shocking the shit out of it, and
Yep.
it's ready. You know.
That's awesome.
I'm ready. This is this third thing. This legs, it's gonna be awesome. I don't know. I did a little bit of bed routines, or this arms. I don't know. It's not. I don't know. I don't know what to say.
Yeah.
It's nice, but
Yeah.
I noticed that when I was working, that it would affect my speech. I was so out of breath all the time. So
When you were working out, you said?
yeah. I had a physical therapy. I was sweating. I was exhausted, and we're trying something, and I'm just like, and then I'm trying to say something to her, and it's, nothing was coming out. She's looking at me like, what?
Yeah.
I'm like, oh, I'm sorry. I don't know. So
That is actually a good thing to work on, is doing something physical while you're talking to, because then it's making your brain divide attention between two tasks.
Yeah.
Versus like when we're sitting and talking, you're able to focus 100% on the speech side of things.
Yeah.
That is an activity that
Yeah.
that would not be a bad idea to kind of work on.
I think about it like, if I'm sitting at anything 5 years from now, is something going to come up? Like, is this always going to be here, or like, am I going to like go to 18 months, says boom, it's done? But then when I do workout, when I do exercise, when I'm angry with someone or whatever, then I can't finish the thought, and it's frustrating. So is there a stop game for this, or
You can really make the most, now not all the progress, you can make the most amount of progress in the first year.
yeah.
So after that, it's not that you can't make any progress, because I've seen people make good progress further than that.
Yeah.
It just slows down some. You might always have a thing where if you're frustrated or if you're really tired that the words are just a little harder to get out, you might always have that.
Yeah.
But considering you're just shy of the 3-month mark, and this is the amount of progress that you've made, I feel good about like the progress you will continue to make over the next.
So it'll be one of the things where, like, in an argument, right? Will the words come to me, or will I choke with my, like, hey, like,
Yeah.
I'm breathing, I need to breathe, like all this stuff, and they're still attacking me, and I'm like, whoa.
Yeah.
What do I do? Like, I guess I'm trying to see the shock, and you know me now that you've been working with me for about a month or whatever, and where am I at? This is going to be not 3 months, then 6 months, then a year, 18 months. What does it look like?
It's really hard to say,
Yeah.
unfortunately. It's kind of one of those things where, like, so if you have a knee injury, I forget if I've used this analogy before. If you have a knee injury and you have to have a knee replacement or surgery or something, your doctor can usually tell you, well, it'll be about, this many days until you should be able to put full weight on it, this many weeks of therapy, and then you should be about back to normal by, 2, 3, whatever it is. They can usually give you a really good idea of what the healing process looks like, but the brain is so complex that we can take someone that looks just like you, same age, same medical history, give them the same kind of stroke, and you guys may respond totally differently. You might have someone who is just back to normal immediately, and someone who...
I have another question.
Yeah.
So I like this. The neurology this Wednesday. I thought it was my heart. It's actually neurology, and he's gonna answer me a lot of questions for me. So, and when you go and understand the brain and all this things that, like, all the working that doesn't work and everything. I lost track of thought.
You're
but
right.
it's like, I don't know, like, what am I even trying to do? What was this thought? Oh man. Is it possible that I will have, like, I'm having a hard time, and it could just be I've had a stroke, and it'll feel like there's another stroke coming. Why? Is it possible that I'm having another stroke? Like I'm starting to look forward to it, or how many people repeat strokes? Do you know what I'm talking about?
Yeah, I don't know the numbers on that. I know that once you've had 2 strokes, you're much more likely to have a third. But as far as having a single stroke, I don't know that it increases your risk factors by quite as much. I can look it up.
Yeah. Is it possible, like is it medication? I don't want to get too much into it, but if you
Yeah.
I try not to take any medication
Right.
because I don't want it to involve myself with this. And then I had a stroke, and I was like,
Yeah.
oh my God, and I clutters, and then
Yeah.
like all this alcohol too, and I had an issue, but I know that I need to lose weight, and I know that I can do it, but what do I have to watch out for?
Yeah.
I don't know.
Like what the signs of having another stroke are?
Yeah.
I mean, depending on the type of stroke and where it's happening and everything, you'll notice different symptoms. You might notice the same type of symptoms that you did last time. I guess have we ever talked about like how did you know you were having a stroke?
Yes and no. Like I can communicate better, so that's
Yeah.
good. But
Yeah.
the one thing was I was laying on my arm. I was like, what the heck? I was
Yeah.
like, oh, this arm is numb.
Yeah.
And there's no feeling. I
Yeah.
was like, wow, what the heck? So I put it on my side, and I was like, let's wake it up. There's nothing wrong with my legs. I was talking. I was able to, let's go ahead and let's wake it up. And I was still tired, and I had snooze. And 2 hours later, I was starting to feeling my leg, and I was like, oh man, I need to start my bill. I was to get dressed and everything, and then I fell down. I was like, oh my God, this is hard. And
Yeah.
I said, I'll lay down, take another nap, and then everything was asleep, and everything was numb, and this
Yeah.
it was terrible.
Yeah.
And then I waited 12 and a half hours, and who knows when the stroke started. Could have been in the middle of the night or
Yeah.
whatever. So it brought me down, and it said he was like, well, we have to go to the emergency room where he has stroke. Like,
Yeah.
we did something
Medicine.
to remove out of a brain cell, something, and that's part of my question.
Yeah.
But he said I had a half hour to live. Like this is it. Like, and my mom.
So you barely got there in
Yeah.
time.
It's scary.
That's extremely scary.
But I don't want to have another one. Like,
Yeah.
what is the difference?
Do they know what caused this one?
They believe that my whole heart
The
sent,
hole in the heart, right?
sent something up to the brain in the nerves or whatever, and that was it. I don't know what that means. Like, what does that mean? Is it complicated? Was that blood clot? Like, where is the, because I don't have clots. Where's the clot? So.
That you're out of my territory.
Is it normally it hits like people that are obese? Do you have to be overweight, or have to be out of shape, or you have to be?
That doesn't help things.
Yeah. I'm down 30 pounds. I set it my goal. I'm gonna set 100,
awesome.
100 pounds.
Yeah.
And I don't know. Let's go get it.
Talk with your neurologist about like what conditions you might have that he's concerned about. So like this is talking about high blood pressure, high cholesterol.
Well, for 3 months, that's been my blood pressure. It's the same. Well,
Yeah.
it was lower. It
Yeah.
gradually got here, and this is pretty much the same. Like,
Yeah.
we're all
You
around the
run
same.
very consistently, like
Yeah.
right at the normal.
Yeah, and 97. You're like, come on, like there can't be anything wrong with my blood pressure. There has to
Yeah.
be something else.
High cholesterol, diabetes, AFib, which is like an irregular heartbeat.
I do have one of those. Yeah, that's one.
That's a risk factor.
Yeah, there's 2 of them that he said. The number 2, and I'm both. AFib, and there's whatever the thing is, the second thing. I think that's easy to beat, but then boom, why? So I just have to know
Yeah.
better.